MPs sitting in the Health Committee invited the nurses and surgeons who carried out a neurosurgery on a wrong patient at Kenyatta National Hospital as they sought to understand the ongoings at the medical facility. The surgeons who carried out the operation, both university students at University of Nairobi, told MPs they confirmed the biodata of the patient with the file and CT scan before operating.
In this instance, the patient was confused. So we confirmed with the name that was on the patient label. This name matched the name on the patient's file and the name on the CT scans, which the images he came with. The inpatient number on the patient label, this matched the inpatient number on the patient's file. And also we used phone records. The ward was called and confirmed the patient was indeed John Deritu during this surgery at least twice.
Once we opened the cranium, our expected finding, we could not find the expected findings according to the CT scan. And at that point, we went back to the CT scan together. We had a discussion again, went back to the patient, and still we could not locate the clot. It's at that point we decided to invite Dr. Dave Manga, who promptly arrived.
Their surprise came when they opened the patient's skull and could not locate the blood clot, which required operation. The two registrars called on their senior doctor for assistance, who also failed to locate the blood clot and consequently called on his senior to assist. MPs questioned the nurses on how the details and labeling of John Deritu, who required the head surgery, had been mixed up with that of Samuel Kimani, who didn't require surgery.
Where patients are confused or non-responsive, what methods do you use to ensure? A. Consent. B. The correct patient is on the surgical table. What do you do that?
Who received those patients at A&E, that is accident and dementia? Because that is where probably most of these issues we are getting into all the way to theater began. Who received these two patients?
Who labeled this patient? Who labeled this patient and saying this is a patient who needed surgery? And number 3, Dr. Lingang has told us that they did this operation for almost 6 hours. So we have a patient missing from the ward for 6 hours. Nobody realized that we have a patient missing in the room because this was a long patient.
I did not receive the patient with a red box. I'm the one who wrote it on traffic.
The nurse on duty during the incidents confirmed the two patients had been referred from casualty to theatre ward without necessary labeling. The nurse also informed MPs that she called out the name of John Deritu to identify the patient, and whoever responded was taken to theatre for surgery. Unfortunately, it was Samuel Kimani who responded on behalf of Deritu and was consequently operated on. The family of John Deritu, who required the surgery but was discharged without being operated after the mishap, also appeared before the committee.
In fact, there's a time I received a call, I think it was on a Wednesday morning on 20th, to come to Kenyatta to see a certain professor. And a nurse denied me to see that professor. She refused, and she said she did not tell me to come.
MPs heard of trauma that patients undergo at the country's biggest referral hospital in the hands of nurses. Kevin Wachira, Chanoa News.